I would believe in the good intentions of your doctor, your nurse, but this is an imperfect interaction, and it's a very difficult interaction. And ask the questions that you want asked. I think it's so important to, and I would argue that 9 times out of 10, you will see appreciation from that person's face, because they're struggling to identify where are you, what's important to you, what can I do about that? And giving those clues is an incredible gift. I'll just say that to another question Barb asked, this is such a different world. I went through my entire fellowship and never talked about somebody dying from cancer. And we talk about it all the time now. I'm a better physician because of the nurses I work with, because my wife and my kids, but most importantly because of what I learned from people I care for. So ask the questions.
I think along a similar vein, feel empowered. If you have a chronic illness, it doesn't have to be cancer. It could be any one of a number of chronic illnesses, diabetes, whatever. Don't suffer, and when you go to you see your physician or your nurse practitioner, be ready. Feel like you could ask questions, write them down, and take notes when you're hearing the things so that you can go home and feel like you've got some information. And don't suffer, and a message I want to leave is that all of palliative care is not hospice. Hospice is part of palliative care. I want to get that driven home tonight, okay? Because people make that mistake. Oh, it's palliative care, you're going to die. No, it's palliative care is, we're going to do that early. So.
Karen, I would just really like to encourage people to get comfortable talking with cancer patients, family members. I've had so many people say, you know, my neighbor, my family member has cancer, and I just don't know what to say. And I'm thinking, how can we, as such an advanced society, not help them know what to say? So I guess that encouragement is just to continue the conversations. Sometimes I encourage people, if you don't have a complete thought, tell me a half a thought, tell me a quarter of a thought, what's in there a little bit, and so that we would just get very, very comfortable talking. You know, some of the patients don't want to talk about their cancer at that moment. They just want to be normal for a while. They want to take the dog to the vet. They want to, just live their normal life. And other times there's just so much in there they want to talk about. So I guess I think I would encourage us all to do a good job at that, and I know we will.